The nose is an area of concern for a lot of people. It sits in the middle of our faces. It is something that it's the first thing people see often when either you look at yourself or when other people look at you, and it can be really psychologically troubling if the nose is misshapen or people feel their nose is too large or there are bumps and lumps on it. And by the same token, having a surgical rhinoplasty can seem quite a big deal, because it is a big deal. It's an operation, it's permanent, and it's very, very costly as well, or generally quite costly. So what can you do if you don't want to go down the surgical route, but you want to do something about your nose? Well, for certain people, you can have a combination of filler and Botox put into the nose to remedy issues. It's not going to be for everyone, because there are certain things that you can only really fix with surgery. But you can disguise a lot of problems by the judicious administration of filler. I say judicious. The nose it's got big blood supply. It's got some very important arteries running near it. So you've got to be very careful about how you inject it. So again, this goes down to the filler's in a box, the injector's got the needle. You want the injector to be putting the filler in the right place and doing a really careful job, because you don't want to have a problem, just as you may not like your nose, but it's going to be much nicer than if there was a problem with the filler after it. So get someone who knows what they're talking about and does a lot of filler rhinoplasties. In fact, if there's one take-home message from what I'm saying, it's that. Go somewhere good, get someone who knows what they're doing. Anyway, just moving on from that, how do you do it? Well, first of all, you make a really careful examination of the nose and you take a really close history. People might come in and they've already had surgery to their nose and they want something else doing. You've got to be really careful that you know exactly what you're dealing with. But once you've established that, and you've established that the problem is something that filler can help with, then it's a case of you're trying to make, it's a paradox really, because by definition, you're putting volume into the nose, but because you're changing its shape and you're making it maybe more symmetrical, or you're making the light reflex come off in a different way, you can actually make the nose appear smaller, despite, by definition, being bigger. You can use it to treat humps on the nose, hollowings on the nose. You can adjust where the tip of the nose is with filler. And you can also use Botox to raise the tip of the nose as well. So a combination of filler and Botox can be used really successfully to change and modify the shape of the nose. It can last a long time, maybe 2 years, maybe slightly longer than that even. But it's not a rhinoplasty. You will, and it may be something you have done before you have a surgical rhinoplasty, to see if you like it, see if it's something that you really want to do. Because everything we do to the nose with hyaluronic acid filler, we can get rid of. Whereas clearly once someone's had a go at your nose with a surgeon's knife, that's much more difficult to reverse.